morning, colleagues, Your Excellency, Dr. Firas Abiat, Dorothy, and also, our colleague SAID and all other colleagues who are here. It's my great pleasure actually to join you today in this, important event that we are all joining hands actually to raise the awareness, but also the month of March is what WHO calls is a colorectal cancer awareness month globally, and WHO actually we're trying to support, across all communities, at least to raise this awareness. And I think it's something that we all need to be remembered that cancer in general, but more important in colon cancer and colorectal cancer, it's one of the most deadliest disease globally. And I think at WHO, we've been working very closely, Minister of Health, how we can support it better, not only for the colon cancer, but also in cancer in general in these countries. And one thing we have to remember that is, whether we are talking about colon cancer and others, it's preventable. And I think in this area of colon cancer, 75% of the cases can be prevented. I think all the experts have already mentioned exactly what are the prevention measures that can be taken. And it's very easy, some of those. But most important is health education. We really need to educate the public and the people and high-risk groups actually, how they can prevent, and also we really need to follow up into that. WHO, we are working many countries around the world, and some of those countries have taken very seriously on the prevention of colorectal cancer. Actually, they have shown very significant reduction of morbidity and mortality related to the colorectal cancer. And I think I would like to see that in Lebanon we do the same. I think if we continue the momentum, and I think the SAID organization have already initiated with the collaboration with the Minister of Health and WHO, I think we can make some difference in the short term, but also in the long term. Despite being, colorectal cancer to be the, second deadliest globally, but also in Lebanon, as colleagues have said that, I think there is a light at the end of the tunnel. And I think we don't need to lose the hope. It's a preventable, and I think if we really invest the prevention aspect of, and I would like to thank to the Minister, Dr. Firas, 3 weeks ago, he launched the National Health Strategy, which clearly articulates not only for the treatment, but also the prevention and healthy promotion in general. And I think that is what we really need to see how we can implement this National Health Strategy, which addresses the short-term and the long-term prevention aspect of many of the diseases, including the colorectal cancer, as well as others. And WHO, we would like to work all sectors, private sector, public sector, NGOs, the international community, as well as the government, to join hands and see what we can do differently. And the most important thing is how we can help the people to change their lifestyle. And it's not easy, but I think it's doable. And we have role models in this country and a number of other countries in the world that have really made some change. And that's why I think it's my pleasure to work with SAID organization and the Minister of Health for us. When I think my colleague had visited my office a few months back to discuss on this initiative and awareness, I didn't hesitate to offer my support, because this is our priority as a WHO. And I think this is something that we continuously discuss with the Minister of Health. And I have to tell you that both the Minister of Health, WHO, as well as other private sector, we are spending millions and millions of dollars of the treatment of the cancer, especially the colon cancer. But a fraction of this amount, if we invest on the prevention and health education, we can minimize the cost of the treatment. As one of the colleagues have said that, of course, the Minister of Health, WHO, and others, we are trying as much as possible to avail the drugs, of the cancer drugs for children as well as other high-risk groups. But it's costly. And that's why we really need to invest some of this investment to the prevention for high-risk groups. And again, what we are trying to promote is a very simple change in lifestyle, exercise, quit smoking, losing weight, and many of the related areas, which is easy and doable. But it's not only one time, actually. It has to be a continuous healthy education. It started with the family, which goes to the doctors and the community, as well as the national level. And I think right now we have many other communication methods, social media. And I think if all of us We start either tweeting, the Facebook, and Twitter, and many other means of communication, simple prevention messages. We can reach millions of people in these countries, and we will be able to reduce and minimize the impact and also lower the overall prevalence and incidence of colorectal cancer. And I think for us as a WHO, as much as we are supporting the prevention, the curative and also treatment, we are also supporting the research, because we really need to identify additional low-cost test, and also the medicine, and also the vaccine, because we have other cancers that have a vaccine, we have other things who have a very effective drug. I think we really need to advance the research, and WHO would like to work with the academic institutions in this country, as well as at the global sector, and see how we can advance the research and also the other technology that we can minimize for the cost of screening and also the treatment. SAID, as well as the Minister of Health and all others, please count on WHO support. But we would like to emphasize that the prevention is the most cost-effective, and it can minimize the impact, and we really need to push on the prevention aspect of it. But also the treatment, the early detection and also the treatment is a very important step that needs to be taken. And WHO, across all this spectrum of prevention, treatment, the research, and all aspects of it, we would like to work, all of you, in Lebanon, but also we would like to link you up to the global Center of Excellence, in which the Minister of Health recently visited France, and also our cancer center in Lyon, and we would like to work with you and see what we can do differently and to save lives. Thank you very much for inviting us and giving us the opportunity. Thank you very much.